Well, Dr. Nick, here we are again for episode 2. This is great. I'm looking forward to our chat today. And what I want to chat with you about is something that I know we're both passionate about, and it is a major area of focus and passion of mine, and that's burnout. So let's just dive in and talk about burnout. And I suppose I'll start by asking a question. You, as a guy who's published what, 24 books, 22
Something
books?
like that. Yes, it's a lot.
In the 20s of books, you do workshops all over the world. You're renowned as an educator. Like you got a clinical, like a family. I look at your life and what you do, and I don't actually have access to your Google Calendar, but if I'm sure I did, I'd be like, how does a guy manage to do this much and still show up with energy and vitality and life and passion? So I'm curious, what do you do to make sure that you stay on top of things?
Oh my gosh, you don't even know how much stuff I actually forget. So there is a bunch of things, but I'll tell you, the number one thing that I do is I find things that are fun. And I cannot stress this enough. If it's not fun, you have to ask yourself, why am I doing this? Why am I involved in this process? If you're not enjoying it, you got to move on to something else that you enjoy, or find a way to gamify whatever you're doing. So I used to play a lot of video games. You can tell by the amount of stuff that I created, probably do, well, I know I do. I have a ADHD diagnosis as an adult, which I didn't really get diagnosed as a kid. But if I can find myself into hyper focus onto something I enjoy, then the world can open up to me with that. But it winds up being blocks of energy spent here, here, here. So I don't get burned out at any one task.
Love it, love it. And I think it also does require a specific type of person, right? To be able to bounce from area to area. So do you find like when your life that works well, but is that like a universal thing?
Yeah, I would suggest for most people, if you enjoy the process, you're gonna like it better. But there's a couple of key things. If I have to do real focus, like I get up at around 4:30, 5 o'clock in the morning, and that's my writing time right there. Because I know the kids aren't going to be up to interrupt me or anything like that. I can be dedicated time to whatever I'm trying to accomplish. Kids get up around 7-ish in the morning. Then we progress into getting them to school or whatever else it is. And then I have some time for some physical activity. Then I have some time for some practice. Then I have some time for some downtime for family time at the end of the day, or teaching time, whatever it winds up being.
Okay, beauty, beauty. So one of the things that you just said at the very beginning, which I love, is you find joy in it and it's enjoyable. And one of the talks that I do when it comes to how to have a sustainable practice and have longevity in your practice is approaching your practice with alignment and authenticity, which are kind of buzzwords and they sound kind of like, what, who cares? But I believe it's actually the same thing, right? Because when I work with practitioners who are burnt out and we really get to the root of it, there's all the other things I'm sure we'll talk about, like nutrition and exercise and all the important things. But when I talk to them, it's like, well, what's the problem? Why are you burnt out? And they're like, I just don't like what I do. And it's like, you don't like massage? And they say, no, I love massage. I just don't like the type of massage or whatever it is exactly. So there's this like slight misalignment that saps the joy out. And it's so interesting how with a little tweak to make sure that their job is more in alignment with what brings them joy, suddenly the burnout and the exhaustion disappears.
Yep, those are excellent points, Dr. Jess. I think they're fantastic. I think the biggest thing is for burnout, and you can see this in almost any profession. If you do one thing long enough, you eventually get tired of it. So you have to find different ways and different avenues to bring novelty to your brain, new experiences, new techniques, new interaction styles, or different things like that that will rejuvenate your overall confidence and abilities and help you keep that smile on every day. Like, why do we both like presenting so much? It's an opportunity for you to perform and show your knowledge base and have fun while you're doing it. And people pick up on that, which is why they like your presentations in particular so much, right? So it's the same thing. You get reviews all the time, what good teachers we are and all this kind of stuff. It's because we bring enthusiasm and we genuinely care. But the only way I can do that is if I'm mentally okay and ready to actually be in that space for you. So if I that's why I only practice for the afternoon. So I practice from like 2 to 6 typically. And if I practice for longer than that, there would definitely be burnout from it because the time commitment. I've seen practices where people are practicing from 9 a.m. to 8 p.m. And I'm like, what are you doing? You're not going to last with that kind of schedule, right?
Mm-hmm. Yeah.
Yeah.
Yeah. I call this off the table work. So much of what we do, of course, is on the table, whatever type of table it is, but we do on the table work. And then there's that other category of off the table, which I strongly encourage any type of practitioner to investigate and look into, because it doesn't matter if you're a chiro, massage therapist, acu, mental health practitioner. Like you said, if you're filling an 8-hour workday with seeing patients and clients, it's very likely going to lead to burnout because you're either
Mhm.
bored of it or it's just emotionally demanding. So
Mhm.
then what are some examples you might give? Let's use, I mean, let's use a massage therapist as an example.
Okay.
What are some off the table things that a massage therapist could look into so they're only spending a few hours of their day working on the table, and the other part of the day they're doing other things and still able to make an income?
Well, so yeah, so even within that though, what a lot of people think, and this is one of the things I counsel therapists all the time on in our seminars, is they think literally as soon as the person comes in the door, it's sure off on the table. No, we can do so much more with that time, right? You could take that time to do a more detailed assessment, review some basic how to do posture. Let's see how you move, do some squats. Let's see how you twist from side to side, whatever it is. And then you can give your treatment and then focus on exercise rehab or whatever you like, but make it interesting. If you're into yoga, start giving a couple of yoga poses at the end. Maybe you learn some new isolated stretching. Maybe, product plug coming up right here. Maybe you got the instruments for a little bit or something like that, and you mix that up into your treatment. But either way, if you're doing the same treatments every time, you're going to get burnt out. And it's actually probably in your patient's best interest that you actually mix it up a little bit as well. I mean, our evidence-based best practices are all right here. Our manual therapies are really a small player. So a small player overall in what we're trying to do.
Yeah. Yeah, I really appreciate that. And I think actually I want to dwell on that point for a moment about how the actual hands-on intervention, while absolutely essential, plays a relatively small role in the overall efficacy and clinical outcomes. So if we were to be having a hypothetical person who's listening to this conversation thinking like, okay, I'm a manual therapist of XYZ modality, what would be, again, you know what, for the sake of conversation, let's just stick with the same modality of massage therapy. What do you think would be a really good next like submodality or course or something that they could take on so they can fill in those little extra gaps? What do you think is a natural segue?
Well, I mean, you can send me a check later for this one, but ultimately your courses and what you're working on is exactly what people need to see, especially from somebody who's experienced in the industry, right? You're looking for ways that you can reinvigorate and make more passion for yourself in practice because you enjoy the process of what you're doing. The major way to do that is to not give the same treatments day in and day out. Ultimately, you have to meet your patient expectations, which are probably going to be, hey, I'm going to lay down on the table. But within those expectations, you have the nuance to add what is going to give you the best outcomes and results. And the research is pretty clear. Manual therapies help with that. But all of these other things, the moving around, the literature on education of your conditions, even something as simple as reviewing your anatomy and saying, you know what, I'm going to work on your trapezius today. That muscle runs from here to here. Guess what your patient or client thinks then? They think, wow, this therapist is really smart. They really know what they're doing. You spent thousands of dollars and years on that education. Use it more productive.
Yeah, I like that too. I think client education is such an important part of that. And as a teacher, obviously, I really enjoy that part of the process. But what I find is when I take that extra 5 minutes to educate my clients and talk to them about what's actually going on in their body and why the home care and the care plan that I'm prescribing is so important. Those 5 minutes of education, they're like some of the highest leverage 5 minutes that I'm going to have within the whole session.
Yep, absolutely. And the research supports that 100%. Your best outcomes are going to be that high leverage, high interaction with the person. Either you have to front load it right at the very start when they're really paying attention, or load it at the very end, giving them rationale why this is going to give you better outcomes. And once you do that, they're going to realize how much more you care. And you basically build your own practice and have a close practice before you know, right? Friends and family, everybody's referred in because they know that you have their best interest in mind.
That's it. Yeah. Yeah. Cool. All right. So you do what you love. You're passionate. You're a multi-passionate person. And I've decided, by the way, that I'm no longer going to say jack of all trades because we all know the second part of that. Jack of all trades, master of none. I call shenanigans. I'm a multi-passionate individual, damn it. So as a multi-passionate individual that you are, you keep things fresh, you mix it up, you do a lot of different things, right? So you got all these other and it seems like you got a really good productivity setup, family time, social time, things like that. So what else are you doing then in order to keep yourself healthy enough and vital enough that you can continue to do what you do?
Yeah, I'm almost 50 right now. So there's a couple of secrets right there. But I'm going to go back to that statement because most people actually don't know that full quote. I might misquote it a little bit here. It's jack of all trades, master of none will often outperform. There's a second part to that that says being a jack of all trades might actually perform better in life. There's a second part to it. I have to look it up now. Now you're going to make me look it up.
I'm looking it up
regardless,
right now. I wish I had a Jamie.
because there was the second part that everybody forgets about. That actually says being a jack of all trades might result in better outcomes. But for my own personal balance and finding all of it, it's pretty standard stuff right there. It's going to be, of course, good biomechanics, good movements, good energy. Surrounding yourself with positive people who have similar goals, just like we're doing right here, is going to be of huge value.
Mhm.
My exercise routine is about 15 hours a week between badminton, jujitsu, and what else do I do? Well, yeah, weightlifting 4 days a week as well. So that's there. Good diet is there, always mixing things up. And then just trying to find the fun, the joy in everything. Like one of the things I'll ask myself or I'll ask my kids, I think this has really big value for a lot of people. Before I tuck them in at night, I'll say, hey, what was your favorite part about today? What was something that I was really positive about today? So you can go to bed with that mindset of what was something that was really good that worked out for you today.
Mhm. Yeah, I think the research on gratitude is it's abundantly clear and it's abundant in how much there is that ending the day and starting the day with gratitude seems to be one of those high leverage activities that takes very little time. However, sometimes it does take quite a bit of effort. We've all had those days where it's like, what am I grateful for? Nothing.
Yeah,
So
it's been
sometimes it takes a bit of gusto for some, but nevertheless, I really, really do appreciate that. And I do have the quote. It goes, a jack of all trades, a master of none, but oftentimes better than a master of one.
There you go.
There it
Exactly.
is. That's
If
it.
you get
Yeah.
yeah, if you get too pigeonholed on something, that's where the burnout is for people. I get therapists, chiros in here who have been doing, like I can remember one chiro that came in and mentored. He'd been practicing for 15 years, doing the same 2 adjustments on every patient for those 15 years, and he wanted to branch out. And I'm just like, oh, what are you doing here? Right? Like there's so much more that you can offer rather than just these similar adjustments and movements. So yeah.
Mhm. Yeah, I think that's an interesting thing because we were talking about before we started. We were talking about this survey that I've done, right? And I ask virtually every single person who's enrolled in any one of my courses, like, hey, what are you interested in? And ask a bunch of different questions about what type of courses do you want to take? And by far, the number one courses that people want to take are modality specific courses. Now, as a person who my passion is in delivering more of the, I guess, soft skills type stuff, communication skills and rapport building and all these, I'm like, damn it, why can't people want the courses that I want to teach? But the reality is, learning all these different modalities and techniques, it's actually what keeps it fresh. It's what keeps it so you can return to it day after day. And you've got a big enough toolbox that you can play around. That's, of course, one of the things I appreciate about all the different stack of books and courses and workshops that you teach is it gives options. So I think that's a really important part. Keeping, as my stepdad says, take a different road home, switch it up, do something different every day.
Absolutely. And if you left it, even if, I don't know, I just was lucky, I guess. My grade 8 yearbook, I literally said, what was my goal in life? It was to learn or do one new thing every day. Learn or do one new thing to keep you right. And in grade 8, I could come up with that. I was
Yeah.
fortunate to actually have that forethought on it because it creates more interest. The other thing that I would suggest for a lot of these things is if you can find that right balance, like when I go to bed at night, I go to bed at like 8:30 and I am asleep. Like I just zonk right out. So all this burnout stuff, we all know it never doesn't matter what the condition is. Is it depression? Is it low back pain? Is it polymyalgia rheumatica? Whatever you want. If you sleep better, you heal better. So you actually
Yeah.
perform better for everything. So yeah.
Yeah. Yeah, I one of the workshops that I run, which I'll be doing again relatively soon, opening up enrollments, is called Elements of Health. And I go through each of the elements of health, right? And I say the same thing, like number one, by far, sleep. If you're not sleeping, doesn't matter what else you're doing. Your nutrition could be spot on, you could be exercising, you could have great social relationships. Mind you, try having great social relationships when you're not sleeping. Good luck, right?
Yeah, yeah, exactly.
Sleep is just like top of the list as far as things a person can do.
Reducing cancer risks, sleep, number one. Yeah, recovering from chemo. Like these are major life-threatening injuries, and sleep is at the forefront for it. Yeah.
Mhm.
Yeah.
Okay.
I think the other thing though, too, and I know we talked about this earlier, was even in your courses for modalities, all modality-based courses for hands-on stuff should absolutely include this kind of content right here that you're exactly talking about, right? And that's how you would know if you're taking a good course, maybe a future podcast. How do you know if you're taking a good course or not? Okay. Would be
Mhm.
if you can see these other integrated evidence-based best practices. Yes.
Yeah. Yeah, I think that's important. And I think as we move forward with increasing availability to different education courses with, the I guess the ease of access to different forms of courses is
Mhm.
ensuring that they are credible. So definitely put a pin in that for a future course, but
Yeah,
making sure that if it is a technique specific course, that more than technique is discussed, because it turns out it takes a lot more than that.
absolutely. And I love what you said at the very start. Even most of your patient interactions, it's not so much what you do as your manual medicine practitioner or practices. What it actually winds up being is the soft skills that you mentioned. Okay. Did you greet with a smile? Was everybody in a good mood? Did you facilitate the patient's goals? Were they heard? Did you meet their needs? All that is required for an optimal visit. Yeah.
Hmm. Hmm.
Super good
Yeah,
stuff.
building trust and rapport. Like, I think this, at the risk of sounding a little woo woo, I'm diving into that. One of the things that I say is I really believe that the treatment space, whether it's a very clinical setting or a wellness student, doesn't matter. I believe it's a bit of a sacred space. And what I mean by that is, regardless if somebody is coming in for a sprained ankle or major depressive disorder, they're seeking transformation, right? They want to transform from somebody who's in pain to out of pain, from somebody who's depressed to somebody who's out of not depressed. And that transformation from one version of self to the other, that requires a very specific environment where they feel secure. They feel like they can trust the practitioner, there's strong rapport. They feel safe enough to go through that process with you.
Yeah. All of us have examples of that where we have patients where you can't believe the things that they would bring up or say on the table or in the treatment room. And you have to hold that space for that person, give them that confidence, safe, and then offer, just the supporting ear to hear what they're talking about, right?
Mhm. Yeah.
Yeah.
And then not take that home with you. That's the other part is,
Well, the transference stuff, yes. The transference
mhm.
stuff is tricky. That no. Okay.
What do you do for that? What do you do for transference?
So one of the key things that I always do is I try and have my chart notes done with my one patient before the next one starts. That way my thought process isn't brought back to that interaction until I need to be brought back to it, will be number one. And then number two, oh man, I'm not going to give too many specifics. It's one of the worst cases I've ever had, actually. So one of the patients that I treat, she's a trauma nurse and she deals with young kids who have been sexually assaulted. And she's told me some stuff, and you're just like, oh my gosh, like you can't even believe this stuff really happens. And even for myself, it's worth your time to actually talk with a counselor, talk with other therapists, find your network that you work with, and find ways to avoid internalizing that information too much.
Hmm. Yeah. Yeah. I like that. I like that. I think it's important to have a consistent routine in regards to making sure that you're not bringing your last patient into the treatment room with you with your next patient, but also ensuring that you're not bringing any of your patients home with you, because that's
Brilliant.
easy. And regardless of the modality, because we all know that if it doesn't matter what modality you practice, you're going to have your patients who treat you like you are their counselor or psychologist. So you're going to
Mhm.
have a lot of stuff dumped on your plate, and developing the resilience and the fortitude, and importantly, the skills and capacity to not bring that home, such an important ingredient in the recipe of anti burnout.
Yep, absolutely. And that's the thing. Once you start dwelling on these things, like if you want one of the major signs of depression that people don't even realize is you just have these spinning thoughts on the same thing where you're just ruminating on the same problem again and again and again. And it winds up creating this negative thought process cycle. It really doesn't facilitate anything you're trying to accomplish. So to break that cycle, exercise is there, family time is there. Move yourself into some kind of different activity so you're not stuck in the same place associated with the same mental emotional loads.
Mhm. Mhm. All right. So, me being me, I'm like a dog with a bone if somebody says something that I'm interested in. So, in the back of my mind, there has been this thing throughout this conversation where I need to loop back to it. I'm kind of obsessed with productivity. This is a huge area of interest and passion of mine as the jack of all trades, the multi-passionate person. So can we dip into again, like, how you do the things you do? Like, in a day, what percentage of your day are you spending doing family time? I mean, not percentage necessarily, but how do you manage to really fit that in? Because that's what I hear so often with people who are trying to build a successful wellness business. It's like, how? I don't have time to be the accountant and do the marketing and then see my patients and da, 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 let alone spend time with my family.
Yeah, yeah. So again, number one, making sure you have a very supportive partner is going to be key. But again, it's about setting up those blocks of time and realizing when you have to set up those blocks of time. This last weekend, we went camping for 2 days. Well, that's dedicated family time. I bring myself some reading, reviews, and literature, some articles on actually Phelan's test and reverse Phelan's test for some of those looking at sensitivity and specificity. Regardless, sorry, I'm getting lost in that. So if I was to take a typical day, again, I'm up early, I'm writing for a little bit, then it's helping everybody get ready in the morning. If it's like a Monday or a Wednesday, that's my day to actually walk my kids to school, which I will tell you is golden. It facilitates my mental health and you get to know your kids better if you do that. So we walk, it's 2 kilometer walk to school, 2 kilometer walk back. Then I would go to the gym and play badminton and exercise on that day. And then I would come in and treat or teach in the afternoon. And then for supper time, and this is another key one, if you look at the research, social food preparation does wonders for your mental health and your connections with the people around you. Make food together. And that's one of the things that we do. Like last night, my daughters and I, we made spaghetti, we made a shrimp platter thing, and we made cinnamon buns. It was a heavy night because we had a whole bunch of meals for a week and lunch snacks and everything like that. And then a whole bunch of good conversations come out of that kind of stuff too, right? And I really think it's just important to find blocks of time where you can dedicate an hour or two to this, hour or two to that. And if I can teach for just a little bit or treat for a little bit in the afternoon for 3 to 4 hours, that's my open window where I have good energy. I don't get burned out. And I really facilitate my most productive and best version of myself, Rip.
Yeah, yeah. As you're describing that, the terms that come to mind for me are outsize effect and high leverage. These two terms that are used a lot in the scientific literature and personal development world. And to me, it sounds like that walk to school with your kids and the time you spend at dinner with them, it sounds like those are things that have an outsize effect, meaning you wouldn't expect these two things to have as large of an effect on the overall capacity that you have as an individual. And yet they really seem to be. That's so interesting.
You don't even realize what goes on in that. Like you'll ask questions and you're like, why would you think, why, how come you're thinking this thought process? Like a 10-year-old or a 14-year-old or an 18-year-old, which is the age of my 3 daughters, the questions that they ask really are interesting questions you want to answer. Like they'll ask you questions about, Dad, what is a mortgage? Dad, how many hairs are in the human head? Did it all this thing? You just don't even know. And it's just stuff that makes you think about things in a different way and create that bond of, I like to say it's unconditional love is what you have, but just caring, that affirmation of positivity that just fills your heart. I know this is getting a little bit woo here, but it's my kind of thing. Fills your heart and allows you to bring that forward into your next interactions throughout the day. Like when I go
Yeah.
and play, I'm the smiley guy bouncing around, bouncing, and everybody's like, Nick, come over here, come play with us. Da-da-da-da-da. I'm not the best player because it's a pretty competitive league, but people just enjoy beating the crap out of me. And I'll be sitting there with a smile. Okay, this is great. We know. So, yeah.
It's a positive feedback loop, which in I think social engagement, that's a good thing, right? As opposed to biology. Meaning like you put the energy in and you feel the positivity, and there's the overused phrases that are have merit. Make sure your cup is full before you fill others. And I think part of the reason why they're so overused or perhaps just appropriately used is because of how true they actually are. When you
Mhm.
spend time making sure that you're doing the things that really fulfill you. For yourself, it's walking the kids to school those few days a week, and for other people that might be, I don't know, playing fetch with their dog or whatever. But if you can figure out these few activities you do that have nothing to do with work, that are nothing, and they just like, oh, they make you happy, you can suddenly show up in every other action feeling better. And when you do that, others feel better, and then you feel better, and it just keeps getting better and better and better.
Well, I know, and what I was impressed by your teaching when I saw it, and I try and do the same thing, is we can bring that energy to the classroom, and that positivity just is infectious for everyone. So they all enjoy what you're doing, and they can see your passion, and they can relate to it, and then they'll understand the information and want to learn it better, as opposed to, yeah. So according to literature, a 5.3 degree variation on blah 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 doesn't fly, right? Like you want to actually
Mhm.
really communicate and talk with people like you normally would. But I just realized that I have to get in with a painted right here pretty quick. So I'm going to have to cut this a little bit
Oh,
short
good.
there, Dr. Jess. That's okay.
No, that's good. We were just wrapping up, actually. I'm grateful. These little half an hour chit chats, they are phenomenal. So I'm super grateful for your time, Dr. Nick, as always. And I'm really looking forward to the next one.
All right. Sounds good. Me too. And we're going to keep on making better things happen here. It's fantastic, Jess. You do great stuff.
Awesome. Thank you. Thank you.
All right. See you, sir.
Well, thank you so much for spending your time with us today. I know time is precious, and I am truly grateful you chose to share yours with us. Before you go, I want to share 3 key highlights from our conversation that you can take away with you. Number 1 is find joy in what you do. If something isn't fun, either find ways to gamify it or consider why you're doing it in the first place. Number 2 is create dedicated time blocks for different activities, whether it's focused work, family time, exercise. Intentionally scheduling helps prevent burnout. And number 3, prioritize activities that have an outsized positive impact, like quality time with loved ones or morning routines that energize you. Your presence and engagement really mean everything, and I'm grateful to be part of your journey. And a big special thanks to Dr. Nik for joining us for his 2nd episode and sharing his wisdom and experiences with us today. His insights on maintaining vitality and managing multiple professional roles are truly invaluable. If this conversation resonated with you, I would greatly appreciate if you would subscribe and never miss an opportunity to grow, learn, and build more purposeful practice. Your support keeps this space for honest, meaningful conversations alive. So until next time, take care and keep growing.